As a plastic surgeon running a private practice, it's important for us to be booking surgeries. But the most important element in order to have successful outcomes from plastic surgery comes in the pre-operative consultation phase, well before you've ever set foot into the operating room. Sometimes patients may feel rushed into making that decision and don't have adequate time to really sit and understand how the choices that they're making before surgery and making sure that they're optimized for surgery are really oftentimes the most important things to determine whether you have a great outcome or not. So I'm going to walk you through 5 truths that can help protect your health, your money, and ultimately optimize your results. I'm Dr. Eric Agyan, board certified plastic surgeon, owner and founder of Apre Plastic Surgery based out of Portland, Oregon, up in the Pacific Northwest. Having performed over 2,500 procedures in 15 years of practice, there's a lot of lessons that I've learned along the way. Hopefully, I can share some of that experience and spare you from making some of those mistakes and ensure that you optimize your outcomes and not only have good aesthetic outcomes, but also minimize your risk of the procedures beforehand. So let's get into it. It's hard for surgeons to turn patients away. Again, because it's important to be doing and performing surgeries because that's the only way a practice can generate revenue as a surgical practice. But here is the reality. If a patient comes in significantly overweight for a liposuction procedure, for instance, the honest answer that they should be hearing is you need to delay and you need to wait, not we need to do this surgery and get you in as soon as possible. A good practice is going to help you focus on your weight loss first and help give you the tools necessary, or at least refer you to somebody who can help you with that weight loss journey, not only to achieve your best aesthetic results, but also to minimize your risk of complications during surgery. It's important to understand liposuction is not a weight loss procedure. The maximum that we're allowed to remove is about 4.5 liters of fat, which is slightly less than 10 pounds. That can make a huge difference. But again, it's not going to be super dramatic on the scale. And if somebody has a significant amount of fat, not only between the skin and the muscle, which we refer to as subcutaneous fat, but they also have a considerable amount of fat deep internally, known as visceral fat, that's fat that we're not going to be able to get to and address with liposuction. And the only way to get rid of that is through diet and weight loss. Additionally, if we do liposuction first and then the patient loses weight, they could ultimately end up with even more skin laxity or contour issues that require a secondary procedure. If they focused on optimizing and losing the weight up front, then we can really see what it is that we need to address and what is the right procedure to correct that. Maybe in less stages, but certainly at least with less recovery and lower risk. So here's what a lot of people are not going to tell you in your consultation. The best plastic surgery outcomes often come from not having surgery immediately. So one patient I have that comes to mind that really I think exemplifies this. She came in 5'2", 185 pounds. She had already lost a considerable amount of weight. When she started on her weight loss journey, she was 210 pounds. She had plateaued. She worked out all the time, active CrossFitter, ate well, and just felt like this was the best that she was going to be able to accomplish. And what she was coming to me for was a breast procedure. I wasn't willing to accept that that was the best that she could do. And I knew that with some assistance, we could get her to a more optimal weight. The other thing that's important to note about her is despite having a primary care physician, her diabetes was very poorly controlled. One of the measures of how well your blood sugar is being maintained long-term is something called hemoglobin A1C. We'd like that to be below about 6.5. Hers was at 9. So not only was she overweight, but her diabetes was poorly controlled. So with our help and guidance, we got her on GLP weight loss medications. Over the course of months, we were able to get her from 185 pounds down to 135 pounds. And more importantly, get her hemoglobin A1C or her diabetes under that 6.5. So she was in so much better health. And then we took her for surgery. So not only did she have the aesthetic improvements from the surgery, but she said she feels better than she's felt in years. And I think one of the testaments to that was after all of this, she even did a beautiful boudoir photo shoot in lingerie, something she would have never dreamed of doing. So really that's what we're going for. It's not just about doing the surgery or just addressing one thing. We're trying to help patients have transformational results in their overall health and get that really renewed sense of confidence that they feel like they've lost and sometimes have kind of just given up hope on. So before you book any cosmetic procedure, you need to ask yourself honestly, am I at a stable weight? Am I at a healthy weight? How are you determining what that healthy weight would be? So for our patients, we have them do something called an in-body scan. A DEXA scan would be also the gold standard. So what I like about doing this is it's going to give you an objective measure of what your muscle mass is, what that subcutaneous fat, the fat between the skin and the muscle, and what that deeper visceral fat is. It's going to take all of that together and give you a recommendation for how much weight you should lose. And that's really important because a lot of times what we think we should lose is about half of what we really need to lose to get to a healthy weight. Now let's move on to a second myth that is very common that patients are going to hear when they go in for a breast augmentation consultation. 80% of surgeons that you go to are going to tell you that you have to place the implant under the muscle. For decades, really since the early 90s, it's been common practice in North America to place implants under the muscles. There's a number of reasons for this. From the early 90s to 2006, silicone implants were taken off of the market while they were being studied for safety. And during that period, all we had were saline implants. Saline implants have a rounder, sort of firmer structure to them, and placing them under the muscle did create a more natural transition and a softer, natural look in the upper chest. Additionally, one of the things that we are concerned with breast augmentation is something called capsular contracture. And what that is anytime you put a foreign object in your body, it is going to mount an inflammatory response to help protect you. And the way it protects you is by forming a shell of scar around that foreign body. In a percentage of people, however, that response is excessive. That scar can become thick. The consequences of that can range from, in mild circumstances, it just feels a little bit firmer than it should. The next stage would be that it's not symmetric. One's higher or harder than the other. And in the most extreme case, it's painful. In the latter two, it requires you to do something and reoperate. Early studies showed that placing the implants under the muscle had a lower risk of that capsular contracture. So it was understandable why that was the preferred predominant way that we did it. With advancements in technology and implants, we have gotten the capsular contracture rate so low that the benefits are not really superior going under. If you see a surgeon and you ask them about under versus over, they should be able to clearly explain what the advantages and disadvantages are and why they think in you one is the best way. Again, there isn't only one way to do this, and it doesn't mean that if they want to go under the muscle, that's incorrect. But there should be circumstances why and when they are also going to go over. If somebody only has one way of doing something, that should give you pause. They really need to have all the tools in their arsenal to be able to create a customized solution that addresses your anatomy and your particular concerns. So this leads me directly into the next thing, and it's probably a mistake I see more than almost anything else. If you're learning anything from this video that you've never heard before, that's exactly why I wanted to start this channel. Again, I want to give sort of no BS, honest truths about plastic surgery, weight loss, body contouring, and what you need to know and do for you to get your best results that are also going to be lasting results. Subscribe so you don't miss what's coming next. Almost every patient that I see for a breast augmentation consultation comes in with a particular cup size in mind. They want to be a full C, they want to be a D cup. But here's the thing that a lot of patients don't appreciate. Cup size is a very inexact science and measurement. Even within the same brand, different styles can be a different size, and certainly within different brands, bras can fit completely differently. Also, it's very common, I would say almost 50% or more of the patients that I see are not even wearing the appropriate size implant that they should be. They were not custom fitted, and they just find what they feel like fits the best. So I always try to get patients who are coming in for breast augmentation to focus more on what the overall look is that you're going for and not get fixated on cup size or CCs of your implant. One of the big mistakes I think that patients often make is wanting to go too big. They're focused on CCs instead of looking at that overall picture. It's important to understand that The biggest determinant when we're trying to plan what the right implant is for you is what the diameter is of your breast. We need to fit within that diameter and within your anatomy. And the reason it's important is even a 1 centimeter difference in what your breast diameter is compared to maybe your girlfriend or family member can mean a 100 cc difference to achieve the same result. Meaning, if you're 1 centimeter narrower, a 100 cc smaller implant is going to look similar on you to what the bigger one looks like on that other individual with a wider breast. That's why we can't just look at before and after photos and say, those look perfect. That's the CCs that I want, because in your anatomy, it might look completely different. One of the things that I find to be incredibly helpful in consultations is we use Chrysalis 3D imaging. We're able to take photographs of a patient and create a 3D simulation. And using that simulation, we can show what the difference will be between specific different implants. Not only what different volumes will look like, but different shapes, whether they're going to go for a natural teardrop ergonomic implant where there's more volume on the lower breast than the upper and there's a smooth sloping transition, or a round, firmer implant that has more fullness up top and more of a traditional breast augmentation appearance. So using the imaging, that's where the patient can see what the actual aesthetic is that they're trying to achieve, rather than focusing again on cup size or CCs. So ask yourself 3 questions. Number 1, am I choosing a size based on how I want it to look in my body, or based on a cup size or some before and after photos that I saw on a website? 2, has my surgeon shown me a simulation to show me what the differences are going to actually look like between specific different implants, and how is that going to look on your body? And are you being guided towards proportional results, or is your surgeon just willing to put in whatever you say and whatever you ask for? I do think ultimately the patient is the one who needs to make the decision because it's their body, but they also need to be informed of what the long-term consequences may be if they violate the structures of their own breast tissue or go too big, how that's going to lead to stretching, how that may necessitate a lift, and a lot of other additional surgeries down the road. So it may look good in the short term, but there could be a price to pay in the long term for that. Most patients, and honestly a lot of plastic surgeons, think of liposuction as simply sucking out fat. And it certainly is that. But one of the big distinctions in my mind between what I would call liposculpting and liposuction is not only considering what you're taking out, but what you're leaving, what you may be augmenting and adding fat to, and how liposuctioning one area is going to affect adjacent areas as far as proportions and overall contours. Debulking, or just sucking out fat, can make a patient look thinner, but in order to have sculpted results, we really need to know what ideal proportions are and how areas should ideally relate to one another. Areas like the side of the buttocks, or what patients often refer to as hip dips, for example, are areas where we will often take some of that fat that we have liposuctioned out and add it into that so that we can create a gentle S-shaped curve or hourglass silhouette, rather than taking the waist in and having that hip dip, which inevitably is going to make that sort of hip bone look even more protuberant. So if you create a valley above the hips and there's a little bit of a dip or valley below, now it's become a peak or an area that stands out. Oftentimes, patients aren't even considering adding fat to an area because they've lost weight or they're there to remove fat. Adding fat seems counterintuitive, but it's really about achieving balanced proportions, and that's what's going to give you a much more natural look, rather than just taking fat out of one area without any regard or consideration to your overall shape and contour. So when you're consulting with anybody regarding body contouring, pay attention to whether they discuss your body as a whole and how one area relates to another one. If they're only willing to just do whatever you want in your area of concern, they may be doing you a disservice, because afterwards, areas that you didn't treat may be the only areas that you really focus on, rather than appreciating the improvement in the areas that you did treat. That inevitably can end up leading to additional procedures, which is considerably more cost than if you had done it in the first place. And it's also an entirely new set of months for recovery. So it's not about upselling patients. It's not about getting them to do more than what they're concerned about. It's just bringing their attention to how areas relate to one another. And if they aren't interested in treating those areas, that's perfectly fine. But at least they were informed and they got to make the right decision for themselves. One of the things that's most important in the consultation is patients will often come in with a particular area of concern. And practices that just simply listen to that, get the schedule booked with that case, and don't really take the time to understand what the patient's true objectives are, and also informing them again of how operating on one area is going to impact and affect other areas, are really not doing the patient a service. Again, this can end up leading to unnecessary, expensive, additional secondary surgeries because we didn't take the time to just educate the patient on how they're going to achieve a better overall result in maybe a single stage rather than breaking it up into an unanticipated second stage operation. So sometimes you're focused on just the thing like this hanging abdominal skin, but you're not really thinking about, well, if I just address that, it's going to make my waist look bigger proportionately, or it's not going to address the looseness in my side of my hips, my buttocks, all these other areas. So here's what I want you to do before any consultation. Write down 3 things. Number 1, what specifically bothers you about the area you're considering treating? 2, what results would make you feel like the procedure was worth it or that you got what you wanted out of the procedure? And 3, what concerns or fears do you have that you haven't really said out loud yet? So you need to bring that list with you to your consultation so you can discuss it with your surgeon and make sure that they take the time to address all of those concerns and make you feel like you're making the right decision and you're confident about why you're making those decisions before you ever set foot into an operating room. If you feel rushed, or if you feel like they aren't telling you everything because they think you can't afford it, or they're only just trying to limit that consultation and get you booked for surgery, you might want to pause and get a second opinion because they need to be thorough and let you understand the entire picture. Whether you choose to do all of those procedures at one time is fine. Maybe you need to break them up, stage it, but at least you're informed and you know what you're going to need to do to really achieve your best results. So the big takeaway from this is the best plastic surgery results do not start with just deciding what procedure you want. They start with choosing the right surgeon who's going to be honest with you. They're going to be comprehensive and make sure that you're well informed as the patient and you're making the correct decision to achieve your desired results. And they're willing to potentially delay surgery if it's going to mean better outcomes for you. That's really a good test. If they're willing to do anything and they just want to get this thing booked as soon as possible, they might be putting their financial interest above what's really going to help you achieve your best results. And you deserve somebody who's willing to invest the time and help you do the things necessary to not just have your best aesthetic results, but really achieve transformational changes in your overall health and wellness. You deserve it, and you really shouldn't settle for less. If you found any of this helpful, the next video I'd like you to watch is my breakdown on how we address loose skin after massive weight loss. I'm going to go deep diving into one of the biggest things that I'm seeing with the rise in popularity of GLP medications and what different things actually work to correctly address the problems rather than partially address the issues. So it's right here on the screen. I'll see you there.